the WHO Africa Media Briefing, which is taking place in collaboration with the APO Group. And first, some housekeeping as always. You can choose the language you'd like to hear for the press conference at the bottom of the Zoom application where there's a globe, and choose the language of your preference. Also remember that you have a chance to ask your questions to the experts on the briefing, and to do this, please use the Q&A function still in your Zoom application. Please remember that you will need to provide your name and the name of the organization you present for your question to be answered. And due to the volume of questions that we normally receive, we'll only be able to take one question, and kindly remember to prioritize your questions.
Bonjour à tous et merci de vous être connectés pour ce point de presse de l'OMS Afrique. Vous pouvez utiliser l'outil d'interprétation de Zoom, le petit globe dans la barre d'outils, pour choisir la langue dans laquelle vous voulez entendre la conférence. Pour poser vos questions, merci d'utiliser l'outil de questions-réponses intégré à Zoom. Et si vous précisez votre nom, votre média, et si vous souhaitez que nous prenions votre question en live. Merci à tous.
Thank you, Francois. Joining us from Brazzaville this morning from the Republic of Congo is Dr. Mashidi Somoweti, the WHO Regional Director for Africa. And I will now welcome Dr. Somoweti to introduce our other panelists.
Thank you, Fiona, and good morning, good afternoon, bonjour, and welcome to all the journalists and colleagues joining this press conference. The African region is dealing with a dual risk and burden of Ebola and COVID-19. And today we'll look at the rollout of vaccines to control both of these diseases in African countries. I'm very pleased to be joined by and would like to warmly welcome for this conversation Dr. Franklin Asiedu-Bekwe, who is the Director of Public Health for the Ghana Health Services. Yesterday, Ghana became the first country in Africa to receive COVID-19 vaccines from the COVAX facility. I'm also very pleased to be joined by Dr. Bashir Kante, the Senior Advisor at the Ministry of Health in Guinea. Bonjour et bienvenue, Dr. Bashir, to discuss the rapid rollout of vaccines in response to the Ebola outbreak. There have now been over 3.8 million confirmed COVID-19 cases on the African continent, and over 102,000 lives have been tragically lost to this pandemic. COVID-19 vaccines will save thousands of lives in Africa and help economies and livelihoods to recover faster. AstraZeneca vaccines arrived in Ghana yesterday and are scheduled to arrive in Côte d'Ivoire tomorrow, followed by 24 other countries in the region that have completed the pre-shipment requirements. These deliveries are expected in the coming week. The vaccines are being delivered by the COVAX facility, which is co-led by WHO, Covey, and the Coalition for Epidemic Preparedness and Innovations. And this is a multilateral partnership that really aims at assuring equity in access to vaccines, leaving no one behind. COVAX is aiming to deliver 2 billion COVID-19 vaccine doses globally in 2021, including around 600 million to African countries to cover the most at-risk 20% of African populations, including frontline health workers, older people, and adults with comorbidities. And I'm sure you are aware that the African Union is also working very hard to mobilize and provide additional vaccines to countries. With these shipments and vaccines procured through other sources, more than half the countries on the continent should have vaccination programs underway in the coming weeks. This is a much-awaited leap forward for African countries that have spent months preparing from the sidelines while wealthier countries raced ahead with vaccination. While celebrating this feat of solidarity, there is still a tremendous need for more investment in vaccine equity, including sharing of surplus doses by wealthier countries. It cannot be stressed enough. No country is safe until all countries are safe. To end the pandemic, all countries must move forward together. Turning then to Ebola, where a highly effective vaccine has been critical in controlling previous outbreaks, and is now being used in the response to outbreaks in Guinea and the Democratic Republic of the Congo. A delivery of 11,000 Ebola vaccines arrived in Guinea on Monday, and 24 hours later, a vaccination team was in Zerekore starting the rollout. In fact, our representative in Guinea sent me a photo of himself in the plane flying there, and then pictures as well of the process as it was unfolding. So far, 225 high-risk contacts and frontline health workers have been vaccinated. In the DRC, vaccinations began 8 days after the resurgence of the virus in Butembo. WHO has led the support, and our team and partners are on the ground supporting vaccination efforts. Over 650 health workers and high-risk contacts have been vaccinated. Meanwhile, the 6 West African nations bordering Guinea are scaling up Ebola preparedness by urgently finalizing their national preparedness and coordination plans in line with the WHO readiness assessment tool. And I'm aware that I think on the 2nd, there's going to be a ministerial meeting of these countries to discuss how to work together. Surveillance and screening are being stepped up at border crossings and in high-risk communities. Rapid response teams are being deployed to border areas to support preparedness plans of the health districts. We've learned the hard lessons of history, and we know with Ebola and other health emergencies, preparedness works, and communities need to be engaged and enabled because they play an important role in preparedness and especially in the response. It's act now or pay later in lives lost and economies ruined. So far, Guinea has reported 9 cases of Ebola and 5 deaths, and the Democratic Republic of the Congo has reported 8 cases and 4 deaths. I will end on another somber note. The killing of Italy's ambassador to the Democratic Republic of the Congo, Mr. Luca Attanasio, after a World Food Programme convoy was attacked by armed groups, reminds us of the persistent danger that response teams and humanitarian workers and healthcare workers face in North Kivu. I extend my deepest condolences to the family of Ambassador Attanasio and the families of those who have died in Guinea and the DRC due to Ebola. I thank you once again for joining us, and I look forward very much to our conversation today.
Thank you very much, Dr. Somoweti. Indeed, sad news there that we got from the DRC. Dr. Bashir Kante, we are hearing very many good things in Guinea in the response to Ebola. Could you kindly shed some light on Guinea's launch of a vaccination campaign with the Ebola vaccine?
Merci bien de me donner la parole. Je remercie donc et salue la directrice de nous avoir conviés à cette conférence de presse, ainsi que les différents panélistes et la presse ici présente. En effet, comme vous savez, depuis le 14 février, la Guinée a déclaré donc cette épidémie à la maladie à virus Ebola, et des actions ont été prises immédiatement. Et grâce au soutien de nos partenaires techniques et financiers, notamment l'OMS, qui nous a permis donc de convoyer et d'accélérer le processus d'acquisition de ces vaccins. Il faut dire que nous avons eu un retard de 24 heures qui a été dû essentiellement pour des causes météorologiques. Nous avons dû donc passer par d'autres artifices pour pouvoir donc aboutir à cette effectivité. Ce qui fait qu'à la date du 23 février, les vaccins étaient effectivement arrivés dans la région de Zerekore, la région forestière de la Guinée, et la vaccination a eu lieu. Et cela a eu lieu en présence, notamment comme Madame la directrice l'a dit, il y avait le représentant de l'OMS qui était présent, et ainsi que le ministre de la Santé également était sur place. Et il faut retenir qu'au jour d'aujourd'hui, par rapport à cette vaccination Ebola, la sensibilisation a déjà été faite, elle continue encore. Et à J1, nous avons pu vacciner 51 personnes qui sont notamment les contacts au niveau de la région de la forêt de Zerekore. Et à J2, nous avons totalisé un total de 160 personnes également. Et il y a 3 sites de vaccination qui ont été définis. Il s'agit un dans la préfecture de Bouéké où l'épicentre se trouve. Il y a également un centre de santé amélioré qui se trouve à ce niveau où également un site de vaccination a été fait. Et au chef-lieu de la région de la forêt, à Zerekore, un autre centre de vaccination a été également mis en place. En termes de charge de travail, ces 3 sites sont censés vacciner au moins 100 personnes chacune, ce qui fait un total de 300 personnes par jour dans un premier temps. Et il se trouve qu'au jour d'aujourd'hui, à J2, dont les statistiques qui nous sont parvenues, nous avons déjà vacciné 160 personnes, ce qui avoisine à peu près les 52% de la vaccination. Il se trouve que le travail est en cours, la sensibilisation aussi se fait, et nous espérons que dans les jours à venir, nous allons avoir également un plus grand nombre de personnes vaccinées afin de circonscrire correctement cette épidémie. Voilà en gros pour ce qui est de la vaccination. Il faut noter aussi qu'au jour d'aujourd'hui, que les 2 cas qui étaient hospitalisés sont guéris. Et nous avons actuellement un cas confirmé que nous avons aussi qui est sous traitement. Sinon, pour le moment, les choses et les activités se poursuivent. Il faut noter aussi qu'au niveau des personnes qui étaient suivies, au jour d'aujourd'hui, nous avons 276 qui sont suivis. Nous étions déjà arrivés à un chiffre avoisinant les 340 contacts. Donc, le processus se poursuit. Nous espérons que nous pourrons y remédier dans les plus brefs délais. Je vous remercie.
Thank you very much, Dr. Kante. And now to Ghana. Yesterday was an ecstatic day for all of us, and as you can see, we are still celebrating Ghana being the first country globally to receive the COVID vaccine from the COVAX facility. Dr. Franklin Asiedu Bekoe, could you please tell us about Ghana's rollout of the AstraZeneca vaccine through the COVAX facility?
Thank you very much, and good morning and maybe good afternoon to everybody. Let me say that yesterday was a very interesting day for Ghana, and we worked very much enthused when we realized that we were the first country to actually receive the COVAX facility. It has been a long road. I would like to appreciate WHO, UNICEF, and all other key partners for what has happened to Ghana. So yesterday, as you said, we received 600,000 doses of AstraZeneca vaccine, and we actually started the road when we submitted our application on the 4th of December. Apparently, the deadline was on the 7th, but we managed, working with our colleagues from World Bank and WHO, to submit on the 4th of December. And after that, we worked with the Ministry of Justice and Attorney General to address the challenge of the indemnity. Let me say that clearly the Ghana's response to COVID is actually very high level. We have a task force which is actually headed by the president himself. So he ensured that activities are actually well addressed. We looked at the indemnity issues. He thought that it was ready to go. So we actually filled it. Let me say that in order to get the whole development ongoing, we established a Ghana Technical Working Group that was made up of people from the Ministry of Health, Ghana Health Service, WHO, UNICEF, and all other key partners. And the mandate of that group was to ensure that we have a national development plan for COVID-19. So we actually submitted an initial draft to the platform, and then after the initial revision, we had to submit the final document, which was accepted. Let me say that in Ghana's plan to address COVID is based on 2 levels. The plan of the president is that we need to vaccinate all 20 million Ghanaians who are eligible. So though our population is about 31 million, we say that for a start, we're going to vaccinate 20 million Ghanaians. And we are doing it in 2 ways. So it's based on segmentation. So segmentation by population and segmentation by geography. So we looked at where are hotspots and then which people are at most risk of getting COVID-19 in Ghana. So for the 600,000 doses that we have received, we are focusing on our high burden regions of Greater Accra, which is the capital, and then Ashanti region, which is the next big city in Accra. So these are the key areas that are going to get the vaccines. In terms of the population segmentation, our focus is to look at the health workers. So they are the top on the list. Then we have people with underlying conditions, including diabetes, hypertension, and then cancers. Then for Ghana, our age is 60 years. So we are also looking at people 80 years and 60 years and above. Then we need to have our government running. So the arms of government, the front line of arms of government, executive, judiciary, and then the parliament are also key people to receive a portion of the 600,000 doses of the AstraZeneca product. Then we are looking at the front line of security. So these are the persons that will form the front line, the first group of persons to receive the doses of the vaccines. We need to state that the Ghana structure has a plan that was worked around a number of technical working groups. So we had communication to address issues about vaccine hesitancy. We think that there's a reasonable number of that challenge in the country, which the communication group is trying to address. Then we have a clear logistics and waste management committee, and then we have the data, we have the safety. So there are a number of committees who are embedded in the National Technical Working Group. Let me say that now that we have gotten this 600,000 doses of AstraZeneca product in the country, the plan is to start the actual vaccination on the 2nd of March. And we are happy to say that the president is going to be the first person to receive the first dose of AstraZeneca. Our plan is to make sure that about over 500,000 Ghanaians will get the first dose. We are hoping that by our plan, we're going to get the subsequent doses. We are very much reliant on the COVAX facility, which has been very useful to the country. But we're also looking at other bilateral and multilateral facilities to ensure that 20 million Ghanaians will get vaccinated. For now, we are starting with AstraZeneca, and we very much appreciate the effort of all partners. I want to state again, WHO in particular, UNICEF, for the good job done. And I want to say that on behalf of our president, we are grateful for the support, and we want to make sure that all other member states will have the benefits that Ghana has actually achieved for now. So thank you very much for the offer given to Ghana. Thank you.
Thank you very much, and really exciting to hear that from you, Dr. Franklin and Asiedu. Now that we've heard from our panelists, it's your turn, journalists, to ask your questions. And to do this, please remember to use the Q&A function on the Zoom application. And also need to give us your name and the name of the news agency that you are representing. And we, as I mentioned earlier, with the high volume of questions we receive, kindly prioritize your questions and also indicate to us if you would like to go live. And on that note, I'll start with you, Rhoda Odhiambo from BBC Africa, to go live with your question.
Thank you, Dr. Fiona. My question goes to, I have two questions for Dr. Bashir and one for Dr. Nwho. So last week, Guinea announced that it will send samples to the Institute Pasteur in Dakar for sequencing the Ebola virus. So are the results out now? And what do we know so far about the virus that's circulating in Guinea? And to Dr. Nwho, in regards to Tanzania, with now many officials testing positive for COVID-19 and the vice president dying from the COVID-19, has the country now started sharing data on COVID-19 cases and the deaths that they have been reporting? Thank you.
Over to you, Dr. Kante. Please unmute your microphone.
Merci bien. Donc, pour ce qui est des échantillons qui ont été envoyés à Dakar, effectivement, les résultats ne sont pas encore parvenus au sein de notre ministère. Donc, je ne peux pas vous donner de précisions là-dessus.
Okay, so I will respond to the question from the colleague from the BBC on Tanzania. First, I'd just like to say we also have on this press conference 3 colleagues, 3 experts from the regional office: Drs. Ngoi, Mihigo, and Gumede Mweleti. So I will be asking them as well, and so will the moderator, to respond to some of the questions. No, we have not yet received any report of data from the government of Tanzania. However, we have observed that the leadership has stated that they are not against the use of masks. People are being encouraged to sanitize and to adopt some of the preventive behaviors. So we see this as a very positive development, and we expect and hope to very soon start to receive reports from the country and also understand what are the plans for going ahead with preparing to vaccinate the population. Thank you.
Thank you very much, Drs. Somoweti and Dr. From Guinea, Dr. Kante. Now we have a question from Elizabeth Merab, and just like Dr. Somoweti mentioned, we do have Dr. Richard Mihigo, the WHO Regional Coordinator for Vaccine Preventable Diseases, with us here. We also have Dr. Nsenga Ngoi, and he's in charge of emergency preparedness response in the region. We also have the regional virologist, Dr. Gumede, with us, and they will all be able to answer your questions. So this is directed to you, Dr. Mihigo, from Elizabeth Merab Nation, Ghana. Ghana became the first country to get vaccines from the COVAX facility. Is there an indication of when other countries will be getting their doses? Over to you, Dr. Mihigo.
Yeah, thank you very much, Dr. Fiona. Yeah, indeed, as we've heard, Ghana received its doses yesterday. And as we heard from the regional director, Côte d'Ivoire is going to receive the vaccine tomorrow on Friday. We have additional 24 countries that are currently in the pipeline, where all the pre-shipment requirement has been fulfilled. So we are expecting those countries as well to start receiving their vaccine in the coming days. So I think Ghana just was a kickoff of one of the rollout of the vaccine across the region. And as many have said, this is really an exciting moment. And then we hope now that people on the continent will start to be immunized and protected against the disease. Over.
Thank you very much, Dr. Mihigo. And the next question is from Naftali Mwaura from Shinwa, and this goes to you, Dr. Nsenga Ngoi. Briefly describe the state of Ebola outbreak in Africa and whether we are making meaningful progress towards its containment.
Thank you very much, Fiona, and thank you to you have asked the question. So in terms of Ebola outbreak, as in terms of numbers, as the regional directors mentioned, we have 9 cases in Guinea so far and 8 cases in Congo, DRC. As you can see, for DRC, this is a couple of weeks after the first cases have been detected. So far, we are still at 8 cases. So it means in terms of bringing the outbreak under control, very interesting perspective. The same for Guinea. Again, some weeks after the first cases, we are still at 9 cases. Again, this is for us a very good development. And the beginning of vaccination in Guinea as well as in DRC, I think bring us to have hope that we can contain this outbreak in a very timely manner. However, we are very much aware of the challenges we have, specifically in Eastern DRC, as the regional directors just mentioned. Security is one of the issues. So some of the operations, including contact tracing, kind of challenged by the security situation. But we are very hopeful that the colleagues on the ground, they are doing a great job and they can bring the 2 outbreaks under control in a timely manner.
Thank you very much, Ngoi. Dr. Somoweti, would you have any comments to add on to Dr. Nsenga's comments?
No, I just think that the governments have gotten off the blocks very quickly. So in a way, it's showing the accumulation of the understanding, the capacities, based on very painful experiences in the past at the level of the governments, at the level of the partners, and of course, at the level of the communities. So we just hope that we can continue to build. This is part of the process of building resilience. Outbreaks are inevitable, but if we can get the response to be fast at all levels, then we can save lives and make sure we do not have the kind of devastation that we've encountered in the past.
Thanks a lot. The next question will go to you, Dr. Mihigo, and Dr. Somoweti. I will also request you at the end to make comments on the same. So this is from Jana Gent from ARD German Radio, and would like to ask, South Africa and other countries have been asking for vaccine patent suspension during the pandemic. To your knowledge, is the pharmaceutical industry considering giving in, and what is WHO's take on that?
Well, I think the issue of patent for intellectual property is not new. It's not only for the vaccine, it's become more even accurate now because of the shortage of vaccine on the global market. But I think it's very important that particularly during a pandemic time, that people get access to the products that can save life without really making a lot of barrier to that. It's not only for vaccine, it's equally the same for other therapeutics that can help save lives during a situation like the one we are living in a pandemic. So it is a debate that has been ongoing for many years, and I hope that the situation that we are living now within this pandemic will further facilitate the discussion around of sharing patent or intellectual property rights during a time of a pandemic. It's a complicated issue, but this is what I can say on that.
Well, yes, I can only add to what Richard has said. Indeed, this is a matter that was discussed, in the context of another pandemic, very much in the context of the HIV pandemic, when there was such a tragic delay in access to treatment, again, in African countries, which led to the deaths of millions of people. There were some companies that were prepared to produce generic versions of the medicines. This did not happen. So we hope that initially in such context, I will not go into all the devastating, not only health, but also economic impact of this pandemic, which for African countries is going to be felt for some years to come, including on health, that we would hope that the pharmaceutical companies would turn their minds and there would be some flexibility and preparedness to share intellectual property to facilitate access to such medicines. I'm aware that there is a small pharmaceutical company whose name I cannot recall, but we can provide that in Australia, because I happen to be on a BBC program with one of the leaders of that company that were themselves prepared to engage in this. But I think this is a matter that's still very much work in progress, and we are hoping that we can arrive at that principle turning into action at some point in the future.
All right, and for you now, Dr. Kante, this is a question from Idiatu Kamara, and would like to ask, what communication strategy is planned to avoid mistakes of the past? Pure communication, community acceptance to facilitate vaccination, to avoid rumors and issues like that. What is your plan?
Merci bien. Donc, c'est vrai que par rapport aux différentes expériences que nous avons reçues de l'épidémie passée, il est vrai que nous avons tiré certaines leçons, c'est-à-dire qu'en matière de communication, tous les canaux sont utilisés, c'est vrai, mais il faut surtout une adhésion communautaire. Et pour ce faire, cette fois-ci, ce qui a beaucoup changé, c'est que non seulement dans les chefs-lieux où les pays centres se trouvent, nous avons donc les leaders religieux, l'administration administrative et politique, nous avons aussi les jeunes et tout ça, mais il n'est pas sans savoir que c'est une région éloignée de la capitale, et pour ce faire, pour donner encore un plus à cette communication, nous avons pris les différents leaders d'opinion de ces contrées-là et qui résident au niveau de la capitale. Et tous ceux-ci se sont mobilisés donc pour pouvoir aller sur place et donc produire et faire la sensibilisation afin que nous ne puissions pas avoir des éléments fâcheux par rapport à la stratégie de riposte que nous avons mise en place. Et nous pensons que dans un premier temps, cela commence à porter fruit parce que, comme je vous l'ai dit, nous avons commencé avec 158 personnes qui ont été vaccinées à J1. À J2, nous sommes passés à 160 et l'information est en train de passer au niveau de la région par tous les canaux que nous avons, usuels que nous utilisons. Donc, nous restons convaincus qu'avec cette approche participative et inclusive, surtout inclusive au niveau des populations, nous allons pouvoir donc gagner beaucoup en temps et en transmission même des informations et aussi par rapport aux rumeurs qui sont bien sûr cela, et également au niveau des réticences, parce que lorsque les réticences sont présentes et que les personnes qui viennent vous donner, prodiguer des conseils ou essayer de vous convaincre que cela n'est pas le cas, c'est mieux lorsque ce sont des pairs même qui le font, et c'est dans ce sens-là que nous agissons actuellement.
Oh, great to hear that. And our next question goes to Dr. Mihigo, and I will also request the Ministry, Dr. Franklin from Ghana to also comment on this. And this is from Sadia, a broadcast journalist from Somalia, and she's asking, are there requirements that a country needs to fulfill before they are eligible for WHO's COVAX? That's for you, Dr. Mihigo, and after that I will request Franklin from Ghana to tell us what Ghana had to do to be able to qualify for the COVAX vaccine.
Sorry, I was on mute. So thank you, Dr. Tuebwe. Basically, the COVAX facility, if we step a bit back, was created to fill the equity gap that exists mainly when I think learning from the past on the low access of low-income countries to either vaccine or therapeutics. And to avoid the repeat of such thing, the COVAX facility was set up to make sure that all the country, and particularly the low-income country, can get access to a vaccine. So based on a threshold from their GNI per capita, most of the country were deemed to be eligible for this facility in the African region. Out of the 54 countries that we have on the continent, pretty much all of them except 8 were eligible to get access to COVAX facility by receiving supply for free. So Somalia is one of those countries, but to advance indeed and to confirm their eligibility, country had to submit a vaccine request form that is showing that they really want to join the facility. So it was as simple as that. Based on a threshold of the GNI per capita, most of the country fall under that threshold and automatically were eligible to get support through the facility.
Thank you, Dr. Mihigo. Dr. Siedu Bekoe, are you still there with us? If you could tell us what Ghana had to do to qualify for the COVAX facility vaccines.
Yeah, so thank you very much. Let me say that Ghana has been working with WHO, Covey, and UNICEF over the period. So by virtue of that, we actually applied for the COVAX facility. And basically, you look at it and it's about in 2 phases. So first one gives an idea of what you want to do in terms of the whole COVID vaccination. So we actually, as I said earlier, we made that submission on the 4th of December. There was a deadline. It was supposed to be on the 7th. We worked together with our team, including WHO and UNICEF, to make that submission. And then you had to talk about the second phase, as I said, that we need to work with the Minister of Justice and the Attorney General, so that basically we as a country satisfied all the requirements to be able to access the COVAX facility. And we are saying that in that context that we have received the first allocation of vaccines to Ghana. So for our country, I think that we satisfied the key requirements, that is by completing the first and the second phases of the facility. Thank you.
Thank you very much. We have a question for you, Dr. Somoweti, and I will also ask Dr. Mhigo to comment on the same. And this is from Antoinetta Russi from the Financial Times. And the question is, several countries in Africa, including Ghana, have mentioned challenges of procuring COVAX vaccines due to the indemnity clause. Is it fair for low-income countries to accept the same risk as their richer country counterparts? And could WHO or the African Union have come to an agreement with drug manufacturers to pull regional or continental-wide risk? Over to you, Dr. Somoweti.
Yes, thank you. In fact, the COVAX has been engaged on this matter of indemnity for pharmaceutical companies. I mean, first of all, we acknowledge that the process of developing these vaccines, observing the adverse effects, has been relatively rapid. And we are learning more as we go along, but the pharmaceutical companies then felt that they have not had the kind of opportunities to adjust based on what would be observed during the trials, and have made this requirement. The COVAX, and Richard can supplement what I'm going to say, facility has developed a grouped process for this indemnity for the so-called advanced market countries, and as well has put together a fund to support countries to be able then to compensate people who have had severe effects from the vaccination, so that they are able to provide some support to patients and citizens in countries who have been affected by these vaccines, since this cannot be forthcoming from the pharmaceutical companies because of the indemnity. So there has been an attempt to support member states in order to essentially enable them to benefit from the vaccines within the context of the stipulation by the pharmaceutical companies. So Richard, perhaps you can come in with a bit more detail as far as the grouped processes or not is concerned.
Yeah, thank you very much, Dr. Somoweti. Indeed, just to confirm what you have said, the COVAX facility, by the way, launched on Monday this week, the indemnity fund that will is covering all the countries that are going to receive vaccine through the facility through a process of non-fault compensation to all reported injuries that will be potentially linked to any vaccination delivered through the COVAX. So I think this is quite a very, very important development, because this is also alleviate some of the fear that many countries had to go through those agreements and to see, in case there are issues, how their government are going to deal with that. So I think it's a big relief that this fund has been officially launched since the beginning of the week, and hopefully we're not going to see it much used. But on the other hand, for the vaccines that are going to be, as the journalists asked, delivered through the AU platform, I think there is also discussion to see how similar scheme can be put in place. This is exactly to try to neutralize the risk, and then making sure that countries are not penalized when going through this process. Thank you.
Thank you very much, Dr. Mhigo. We see your hand, Sarah Jeving from DEVEX. Would you like to go live with your question?
Yes, thank you. So of the 24 countries through COVAX that are expecting doses in the coming weeks, how many doses total does this include? And are you able to list the countries? And what sort of challenges do you foresee in the coming weeks in efforts to get those doses to them? And then why are other eligible COVAX countries not yet expected to receive in the coming weeks?
That's quite a handful of questions right there, and I'll give those to you, Dr. Mihigo.
Yeah, thank you. I think as has been explained at the beginning, the start in Ghana was just the beginning of a process or rolling process that potentially will reach all the countries. From the number that have been announced, the 24 countries, these are the countries that, and we can later on share those countries by you via email, have already finalized this pre-shipment arrangement where purchase orders have been placed to Serum Institute of India. And situation now is that we are looking at through UNICEF how the vaccine can be shipped now to the countries. So it's clear that even other countries that we didn't mention out of those 24 are going to go through the same process. It's just a matter of time to make sure that they've all fulfilled those pre-shipment arrangements, which I would like to remind, it's to finalize their national development and deployment and vaccination plan, to have the import permit in place, and then to sign the indemnity and liability agreement with the manufacturer. So most of these three requirements are currently being fulfilled by all the country, and we are working really hand in hand with the national government to make sure that these requirements are fulfilled as soon as possible. So in terms of challenges and the number of the doses, I think the first indicative allocation that the COVAX facility shared with all the country were to ship up to 90 million of doses before June 2021. But we know very well that this is going to be something that is going to be done on a rolling basis because of the capacity of production of the vaccine. So we are expecting even Ghana that received the vaccine yesterday, they're going to receive additional installments before the end of June to make sure that everybody receive at least the vaccine that could cover the first tranche, which were estimated between 3 to 5% of the general population to be immunized. And this comprises of all the priority groups that we've heard from our colleague in Ghana.
Okay, so talking about Ghana, Dr. Asiedu Bekoe, you just received just a handful, 600,000 doses in Ghana, and we know that these are not enough to vaccinate the population that you'd want to vaccinate. You said the country is even looking at, your president would want to vaccinate at least 20 million Ghanaians. So the question is, when does Ghana expect the next batch of doses, and where will they be coming from?
Thank you very much. So I think that if you look at our plan, we are looking at, as I said earlier, we are looking at bilateral, multilateral sources of the vaccines. And if you look at also our plan, we are not restricted to the type of vaccine. So we are open to whether it's Pfizer, whether it's Moderna, whether it's Johnson & Johnson, whether it's AstraZeneca. Though our top priority is a vaccine that fits our current cold chain infrastructure. So we currently, as I speak, we have actually registered the Sputnik vaccine. We are also applied to the Pfizer product, and we based on the African Union, there's an African Medical Supply Platform which is also assuring the country some number of doses of vaccines. So on that platform alone, I think that we earmarked about 6 million doses. And the private sector in Ghana is also trying to secure some number of doses. They're having an arrangement with the government to get us about 5 million doses, in which about half of it will actually be under the domain of the government, and then the other half will be under the direction of the private sector. So we are aside the COVAX facility, we are opening our doors and avenues. Let me say that we have a lot of interactions with World Bank. We just had a meeting in World Bank, with World Bank about how they can support us to be able to procure other vaccines aside the COVAX. We also had a meeting last week with IMF. And let me say that the president is very much in support to make sure that 20 million Ghanaians are vaccinated. We are making sure that we're able to address the issue of vaccine hesitancy. And I want to stress that we had a very detailed national development plan for the COVID vaccine, and that incorporates all aspects that we need to make sure that we get the vaccines. So I think that our doors are very much open. We are very, very much relying on the COVAX facility. We're also hoping to get other vaccines outside that. Thank you very much.
Okay, thank you very much. And now this one goes to Dr. Kante from Guinea. Guinea has announced measures to seal off areas affected by the Ebola epidemic. However, after this announcement, social media reports emerged showing that these measures were neither implemented nor monitored. What is the government doing to ensure that all these measures are actually being implemented?
J'ai pas bien compris. Vous pouvez répéter un peu la question, s'il vous plaît?
Okay, so the question is, Guinea has announced to seal off areas that were affected by the Ebola epidemic. However, after this announcement, we have seen from social media reports that these measures were neither implemented nor monitored. So what is the government doing to ensure that these measures will actually be implemented?
Merci. Ouais, je vois. En effet, nous avons mis en place des cordons de barrières sanitaires. Quand on dit verrouiller, ça ne veut pas dire que nous allons empêcher les gens de rentrer dans la zone dépuissante ou de sortir de la zone dépuissante. Il y a des barrières sanitaires qui ont été mises tout autour, notamment à Gweke, bien que pour la préfecture de Gweke, il y a 8 barrières sanitaires qui filtrent les gens à la rentrée et à la sortie. Et toute personne qui sortirait de Gweke, comme on dit, il y a la prise de température qui est faite, leurs noms sont pris, le numéro de téléphone et où est-ce qu'ils vont aller, tout ça est déjà défini. Donc, nous avons déjà un répertoire qui fait que nous puissions non seulement filtrer les personnes qui sortent, filtrer les personnes qui entrent et aussi avoir une possibilité de tracer ces personnes une fois qu'il s'avérait lors de la surveillance que ces personnes-là étaient contact d'un contact et ainsi de suite. Donc, quand nous disons verrouillé, on n'a pas fermé totalement le chef-lieu de l'épicentre, mais il y a des barrières sanitaires qui sont là. Donc, les gens circulent, c'est vrai, mais il se trouve que le filtrage est fait pour les contacts et les contacts des contacts et le traçage aussi appliqué pour toute personne qui sortirait de la zone d'épicentre. Voilà.
Okay, and now this one goes to you, Dr. Somoweti, and it's from Reuters, Ayenat Mercy. The question is WHO in the process of approving the Chinese and or Russian vaccines? And how far are we with that?
Mm-hmm. Yes, the WHO pre-qualification department in our headquarters is actually in communication with the producers of these 2 vaccines, looking at their data, analyzing their data with the aim of issuing, once they're satisfied with the data, an emergency use listing for both of these vaccines. So that is currently ongoing.
Okay, good news. So we are getting more vaccines onto the COVAX facility. So then now we have a question for you, Dr. Mihigo. What explains the unequal access? This is from Pamela Kumba from Channel Africa, French. What explains the unequal access or distribution of the COVID-19 vaccines in Africa?
Well, I think there are several factors that unfortunately, and this is not only for Africa, by the way. I think we know the situation globally of the distribution of supply versus the demand. The majority of doses, as we know, have been pre-ordered by high-income countries, which has definitely led the COVAX facility not to get access to enough dose as we would have wished. So I think WHO, Gavi, CEPI, I think have been quite advocating globally for this, the end of this vaccine nationalism, the equal access and distribution to the vaccine to everybody, and particularly in countries, people who need them more, like the healthcare workers. So it's a situation that is of concern indeed, but for which I believe with now the start of the rollout of the COVID-19 vaccine through COVAX, we are starting to see an end by itself. And even for those vaccines that are coming through COVAX, I think we will make sure that all the countries receive the vaccine at the same time. It's just a matter of a few days or a week before all the different pre-shipment requirements are fulfilled, so that all the countries can get the vaccine for those who need them, and therefore fulfilling one of the important promise of the COVAX facility, which is the equity.
Okay, so we have a question now from for you, Dr. Kante, from Aurélie Mupepe, from the Congolese National Radio and Television. DRC with Ebola resurfacing, she's from DRC. With Ebola resurfacing in Guinea, do we not fear that efforts against Ebola will overtake those against the COVID-19 in a country where the resources are limited? I'll repeat that for Dr. Kante. In a country where you have limited resources like Guinea,
non, on n'a pas entendu la question. Allô?
Yes, we
J'ai pas
can
bien
hear you.
entendu
Kindly
la...
go ahead.
Could you please
Oui, nous
repeat
n'avons
the
pas entendu
question?
des interférences tout de suite.
Okay, so the question is, in a country with Ebola resurfacing in Guinea, do we not fear that the efforts to fight Ebola will overtake the efforts to fight the COVID-19 in a country with limited resources like Guinea?
Bon, ici, il se trouve que, je dirais l'opportunité que nous avons, c'est que c'est la même coordination qui gère donc les deux épidémies. Et il se trouve que l'épicentre par rapport au coronavirus, et surtout le Grand Conakry au niveau de la capitale, est beaucoup moins au niveau des régions. Et Ebola, par contre, est venu en région qui est à distance donc de Conakry. Mais comme je vous dis, c'est la même coordination qui gère cela. Et il faut savoir que nous avons donc des équipes d'alerte précoce qui sont positionnées dans toutes les préfectures et dans toutes les régions de la Guinée. Au contraire, c'est cette présence de ces équipes et de cette coordination nationale-là qui nous a permis donc d'être en alerte assez tôt. Et vous n'êtes pas sans savoir que non seulement en Guinée, nous avons le coronavirus en ce moment, nous avons Ebola qui vient de commencer, mais nous avions aussi une épidémie de poliovirus, de poliomyélite du moins, également de rougeole et de fièvre jaune. Donc, les équipes d'alerte sont là et elles travaillent de façon synergique. Donc, au jour d'aujourd'hui, au contraire, nous profitons même de la présence de ces équipes-là pour pouvoir non seulement faire la riposte au niveau de Ebola, mais aussi conditionner les gens pour la riposte au coronavirus, qui est la vaccination. Donc, nous emboîtons le pas avec ces opportunités techniques, que je dirais, pour pouvoir donc faire face à cela. Et du point de vue logistique, la logistique, elle était déjà en place. Elle se trouve renforcée aujourd'hui grâce à nos partenaires techniques et financiers et également l'appui de tous les organismes d'instances de santé de la région, à savoir l'OAS, le River, et tout le monde donc s'y met. Et à ce titre même, une réunion doit être convoquée à Conakry sous peu pour pouvoir voir quelles sont les stratégies d'harmonisation qu'on puisse avoir avec tous les pays limitrophes de la Guinée, à savoir les 6, et cela sera fait à partir du début du mois de mars. Voilà. Donc l'impact vraiment, il est pour nous une opportunité pour encore mieux faire et de vraiment encore mieux maîtriser et mutualiser nos acquis à travers ce que nous avons.
Very reassuring. Thank you very much. And as we wind up, we'll go to our last question now that is being asked to you, Dr. Asiedu Bekoe, and again it will come to you, Dr. Kante. And it is from Vinicius Assis, a Brazilian journalist. And the question is, the crisis over the supply of medical oxygen for coronavirus patients has struck nations in Africa. Is it a concern for Ghana and Guinea as well? Medical oxygen for management of COVID patients.
Yes, thank you very much. So I think that the lack of oxygen or inadequate oxygen is actually a challenge that has become very evident during this second wave. And so we are actually trying to expand the facilities in our health facilities. We've actually done a good assessment of the current situation, and we are trying to expand it. And clearly, a lot of work has started. We are hoping that we can go around the curve to address this challenge. But it's an obvious challenge that has been identified. Apparently, there was just a recent assessment done by the National Security, and that was brought to the attention of the health service. So we are working to get it rectified. Thank you very much.
Okay, Dr. Kante, do you also have an issue with oxygen in Guinea?
Pour ce qui est de la Guinée, nous avons 2 unités industrielles qui produisaient déjà de l'oxygène. Nous avons donc l'oxygène industriel et l'oxygène médical. Ce qu'il y a comme nouveauté, c'est que ces unités-là, aujourd'hui, produisent plus d'oxygène médical que d'oxygène industriel. Donc, de ce côté, nous sommes vraiment à l'abri pour le moment de pénurie ou de problèmes d'approvisionnement.
That's very, very good to know. An outstanding achievement. So we are now coming to an end of this virtual press conference, and now I will turn to our 3 panelists to hear any final messages, and I'll start with you, Dr. Franklin Asiedu Bekoe from Ghana. 1 minute with your final message for our journalists.
Yeah, so on behalf of our president, we'd like to appreciate the contributions of all our partners, WHO, UNICEF, Covey, World Bank, for the good work so far done for Ghana. I also want to assure Ghanaians that we are committed to ensure that the first batch of 20 million Ghanaians will be vaccinated. We want to count on all Ghanaians and all partners that will do all that is needed to make sure Ghanaians are vaccinated and safe. Thank you very much.
Thank you very much, and indeed we wish you all the very best as you start the vaccination. And to you, Dr. Bashir Kante, for your last words.
Merci bien. Donc, le message que je vais prodiguer au nom donc, des autorités que je représente, c'est d'abord un message de remerciement pour tout ce soutien et cet accompagnement dont la Guinée a été témoin lors de cette maladie, la venue de cette maladie à virus Ebola. Il faut noter que au jour d'aujourd'hui, c'est surtout les ressources que nous avons donc mobilisées, que nous cherchons à mobiliser, qu'elles soient techniques, financières et tout ce qui va avec, parce que pour la riposte d'Ebola, il y a également des conditionnalités, des stratégies que nous avons ici. Et il y a lieu de remercier également l'Organisation mondiale de la santé pour la fourniture donc, de ces intrants, à savoir la vaccination, mais aussi pour la finalisation du plan de riposte qui a été finalisé il y a à peine 24 heures. Donc, ces documents seront largement partagés. Il faut également noter que nous nous sommes inscrits dans la facilité COVAX Et nous espérons que cette opportunité-là va nous permettre également d'emboîter le pas, comme nous avons fait pour la vaccination pour Ebola, et continuer, comme je l'avais dit, la sensibilisation et ressortir le fait que c'est une arme très puissante pour couper les chaînes de transmission au niveau du pays et voire au niveau de notre région. Et nous ne pouvons donc que féliciter cette initiative qui est élaborée et nous restons vraiment et nous félicitons vraiment tous les partenaires qui nous ont accompagnés et j'espère qu'ensemble nous pourrons donc aboutir à des résultats qui seront probants et efficaces. Je vous remercie.
Thank you, and we indeed also wish you the very best for this. And now finally to you, Dr. Somoweti.
Yes, thank you. First, of course, I thank our colleagues, the journalists, for having joined us. And I'd like to say, indeed, this is a very positive milestone and moment for us in Africa as we now contemplate and observe that the COVAX facility has started to deliver vaccines. And of course, we're looking forward as well to the African Union doing the same and the country's own bilateral efforts. It's a very positive moment. I'd like to add that we hope still for the global solidarity that our Director General has mentioned so many times to translate from the wealthier countries. There are some who are contemplating donations of some of their supplies to African countries. We would encourage this very much. And then finally, to our communities in Africa, we'd like to say this is a moment to seize when your turn comes to receive the vaccine. So we have to wait our turn. If you're in the priority group, please accept the vaccines. I'd like to encourage the healthcare workers in Africa, some of whom are raising questions about safety. The vaccines have been thoroughly looked at. The data is sufficient in terms of safety. Please accept this vaccine. The governments have prioritized you for a good reason. I'd like us also not to believe all the fake news that is going around the vaccine. We are working very hard to make sure that people receive the correct information about the vaccine. Let's take this opportunity so that we put our economies, our healthcare systems back into normal operation by everybody playing our role. And then finally, please, the public health measures are also very necessary. Please wear your mask still. Please keep your distance and please sanitize. So these collective efforts are what is going to bring Africa out of this crisis. Thank you very much.
Thank you very much. Thank you very much, Dr. Somoweti, for those encouraging words and also to remind us to keep with whatever we have been doing to prevent the spread of this disease. So I would like to thank you again very much, our panelists. Thank you for joining us today and for the insight. For our French, Francophone and French-speaking journalists, our experts, Dr. Richard Mihigo and Dr. Nsenga Ngoy, will remain with you for a few minutes to continue answering your questions in French. Thank you very much and see you next Thursday for our next press briefing.
Oui, bonjour à tout le monde. Est-ce que donc nous sommes prêts, Dr Mihigo et Dr Ngoy? On peut y aller?
Oui, on peut aller.
Et on peut y aller, mais nous aurons très peu de temps, c'est-à-dire maximum 15 minutes, parce qu'après, nous avons une autre réunion. Donc, si on peut garder les questions dans les 15 prochaines minutes.
D'accord. En fait, aujourd'hui, nous n'avons que 5 questions, donc je pense qu'on fera même 5 minutes. La première question de Baboukar Thiam, du quotidien national du Sénégal, Le Soleil. Il voudrait savoir qu'est-ce qui est prévu par l'OMS dans le cadre de la prévention contre Ebola dans les pays frontaliers de la Guinée et de la RDC.
OK, donc je présume que je vais prendre cette question.
Oui,
pour ce qui est de la prévention par la vaccination dans les pays frontaliers de la Guinée en particulier, oui, nous avons déjà commencé à préparer ces pays pour la vaccination des personnes à risque, et principalement du personnel de santé travaillant dans les structures de santé dans les districts limitrophes de la Guinée. Ceci pour des raisons particulières, puisque c'est vrai que, étant donné les mouvements de population entre les pays, certainement que les populations, y compris les contacts, ou voire peut-être les malades, peuvent traverser une frontière vers une autre ou vers un autre pays. Donc, mais pour faire la vaccination, nous avons besoin de faire cette analyse des risques. En anglais, on dit risk assessment, cette analyse des risques, de voir quelles sont les personnes justement qui pourraient être à risque. Donc, on va vacciner, mais pas tout le monde. On va vacciner les personnes à risque et en particulier le personnel de santé dans les districts sanitaires qui avoisinent la Guinée. Voilà.
D'accord. Merci. Il y a une question également, bon, ça c'est par rapport au vaccin, à Dr Migo, de Thierno Souleymane Diallo, de guineanews.org. Il voudrait savoir, après le Ghana qui a reçu la première dotation en vaccin dans le cadre de l'initiative COVAX, d'autres pays seront bientôt servis. Alors, est-ce qu'il y a des critères particuliers pour qu'un État passe avant l'autre ou après l'autre par rapport à la distribution? À vous, Dr Migo.
Non, merci, c'est une question importante. Un des principes importants au sein de la coalition de l'initiative COVAX est l'équité à travers la distribution de vaccins. Donc, nous n'avons pas des situations où un pays va être priorisé par rapport à un autre. Tout ce que est recommandé, c'est que les pays puissent faire en sorte à ce que les conditions qui doivent être remplies pour que les vaccins soient envoyés dans les pays soient remplies dans le meilleur délai, ce qui va faciliter en fait le processus de distribution. On part du principe que tous les pays devront recevoir les vaccins en même temps et nous travaillons énormément avec chaque pays pour être sûr que les différentes formalités qui doivent les emmener à recevoir le vaccin soient remplies dans les meilleurs délais. Donc, la seule différence aujourd'hui, c'est que certains pays ont été plus rapides que d'autres et vont recevoir peut-être les vaccins un peu plus en avance que d'autres. Mais la finalité est qu'une fois cette première tranche de distribution faite, pour les tranches ultérieures, il n'y aura plus de problème parce que toutes ces formalités auront déjà été remplies et les pays pourront recevoir les vaccins immédiatement et en même temps pour tout le monde.
D'accord, il y a Arissa Tousso de la radio FIM FM en Guinée. Juste pour continuer, en Guinée, quelle est la situation par rapport à l'initiative COVAX pour la Guinée?
Bon, écoutez, pour la Guinée, effectivement, la Guinée, il est prévu que la Guinée reçoive environ 1 20 000 doses des vaccins AstraZeneca à travers COVAX dans les 6 premiers mois. Ces doses, bien entendu, vont être distribuées en différentes tranches. C'est important de le mentionner ici parce que nous ne savons pas encore en fonction de la disponibilité des vaccins au niveau du pays qui produit ces vaccins, combien est-ce que des doses vont être distribuées en Guinée. Mais nous espérons que d'ici le mois de juin, 1 200 000 doses à travers l'initiative COVAX vont être distribuées à la Guinée et des doses supplémentaires, bien entendu, viendront au niveau du second semestre de l'année 2021. Donc, nous espérons que dans les jours à venir, la Guinée pourra également recevoir ces premières doses dans ce processus itératif d'allocation successive.
Ok, merci Dr Migo. Dr Ngoy, il y a Grace Mouniala Lekaba du quotidien d'information sénégalais Enquête. Elle voudrait savoir comment l'OMS compte coordonner auprès des pays africains pour les mesures d'accompagnement d'Ebola et de la COVID-19 et considérant que les pays mettent plus l'accent sur la COVID-19. Que pouvez-vous répondre?
Oh, désolé, je
peux répéter la question?
Non, j'ai compris la question, je peux répondre. Non, je disais, je comprends que tous les pays ne sont pas, si on peut le dire, au même niveau du risque par rapport à Ebola. Les pays qui sont pour le moment éloignés de la Guinée, par exemple, ou de la RDC, donc peuvent donner priorité logiquement à Covid puisque le risque est moindre. Par contre, les pays qui sont vraiment environnants de la Guinée et d'une partie de la RDC, puisque pour la RDC, c'est essentiellement le parti longeant, la partie est de la RDC, ces parties-là, je crois ces pays-là, je pense qu'ils sont en train de prendre toutes les mesures nécessaires pour se préparer et pour être prêts dans la préparation pour lutter contre Ebola. Donc, oui, le niveau des priorités ne peut pas être le même dans tous les pays de la région africaine de l'OMS, tout simplement, puisque le niveau du risque ou le risque que Ebola traverse des frontières vers leur pays n'est pas égal pour tous les pays.
D'accord. Et la toute dernière question à Dr Nwho, de la part de Odile Harvey, elle commente expliquant que le Sénégal n'a pas attendu l'arrivée des vaccins COVAX, mais s'est adressé directement à la Chine et a commencé la vaccination avec le vaccin Sinopharm. On sait aussi que la Chine a distribué son vaccin aux Seychelles, dans des Émirats arabes unis. Alors, ne craignez-vous pas que si le COVAX est trop lent, la Chine va déployer sa diplomatie du vaccin dans de nombreux pays d'Afrique?
Non, je crois que c'est une question très intéressante. Je crois que le problème n'est pas si le COVAX est lent ou pas. Je crois qu'il faudra mettre les choses, c'est vrai, dans leur contexte global. Nous avons vu la situation que, d'ailleurs, l'OMS a fortement décriée de l'inégalité à l'accès des vaccins à travers le monde. Ce n'est pas une situation unique aux pays qui sont servis par COVAX. On l'a vu dans beaucoup d'autres pays. Pour avoir accès aux vaccins, ça a été un problème de gouvernance globale. Et d'ailleurs, c'est pourquoi nous avons dénoncé au niveau de l'OMS le concept de nationalisme vaccinal. Alors, pour ce qui concerne le COVAX, c'est vrai que les choses vont certainement maintenant être accélérées et nous espérons que d'ici les 3 ou 4 prochains mois, avant juin, il y aura 90 millions de doses de vaccins qui vont être délivrées dans les pays au niveau de la région. C'est énorme, c'est un bon début et ces quantités vont augmenter et monter jusqu'à 600 millions de doses d'ici la fin de l'année. Alors, les quelques doses qui ont été effectivement délivrées par la Chine à travers les pays, bon, écoutez, les pays se trouvent dans des situations où ils ont essayé de frapper à différentes portes pour faire vacciner leur population, vu l'absence des vaccins qui s'est trouvée au niveau global. Mais nous espérons que cette situation va être rapidement corrigée parce que les vaccins COVAX maintenant arrivent, mais nous avons également les vaccins qui vont être délivrés par la plateforme de l'Union africaine, ce qui fait que nous aurons suffisamment cette fois-ci des vaccins qui vont être livrés au niveau des pays et surtout des vaccins qui auront l'autorisation d'utilisation en urgence délivrée par l'OMS et c'est ce que nous recommandons fortement à tous les pays.
Ok, merci à tous. C'était fini, mais il y a une question qui vient d'apparaître dans le chat. Je ne sais pas si on peut la prendre en toute dernière. C'est Arissa Tousso de Guinée qui voudrait savoir si l'OMS a déjà commencé à inquiéter sur l'origine de cette nouvelle épidémie d'Ebola en Guinée.
Oui, vous avez entendu, on a posé la question à Dr Kanté, je crois, concernant le séquençage du virus. Le séquençage, un des objectifs, c'est justement déterminer d'abord le type de virus et éventuellement l'origine, si on peut le déterminer. Donc, ça, c'est une partie de la recherche qui est faite pour déterminer l'origine. Même en RDC, d'ailleurs, même en RDC, où on a maintenant le séquençage qui a été fait, que c'est la même épidémie que la 10e épidémie de la RDC. On détermine encore, par exemple, pour l'épidémie, la 11e épidémie de l'Équateur, pour voir quelle était l'origine animale. Donc, les recherches continuent, même si l'épidémie est terminée, par exemple, pour la 11e épidémie de la RDC, les recherches pour déterminer les origines du virus continue. Et pour la Guinée en particulier, oui, le séquençage va nous déterminer d'abord l'espèce même des Ebola virus et puis de là, continuer des enquêtes pour voir quel est l'acheminement qui a été fait pour que le virus puisse sauter du milieu animal naturel vers le milieu humain.
Ok, donc c'était la question qui venait d'apparaître. Sinon, on est venu à bout des questions. Et je voudrais vous remercier, Dr Mihigo et Dr Ngoy. Cette semaine a été très légère par rapport à la semaine dernière. Et donc, merci aux journalistes qui nous ont fait parvenir leurs questions. Et je vous souhaite une bonne fin de journée à tous les deux et à tous les journalistes.
OK. Merci beaucoup et bonne journée.
Merci. Au revoir. Merci.
Au revoir.